Welcome, everyone. Thank you so much for joining us with the National Runaway Safeline, as well as Boys and Girls Club and House of Hope. My name is Sarah Allen, and I am the Director of Programs at National Runaway Safeline. And this is our second Lunch and Learn in honor of Youth Hope Month. So I am just here to introduce your host for this Lunch and Learn, which is Katie Van Groll from Boys and Girls Club and Shannon from House of Hope. And with that, I will go ahead and hand it over to Shannon and Katie to introduce themselves.
Thanks, Sarah. My name is Katie Van Groll. I work with the Boys and Girls Clubs of the Fox Valley in northeastern Wisconsin. Um, I have been here about 6 years working in the RHY world. Prior to that, I have still a lot of history with kind of overlapping populations with foster care, child protection, and youth and adolescent therapy. So I'll let Shannon tell a little bit about herself, and then we'll get into how we're connected.
I'm Shannon Wienant. I've been here at House of Hope for about 13 years now. And our specialty here is helping youth experiencing homelessness to find safety and stability through our shelter and some of the housing programs that we provide. And we work together with Boys and Girls Club, as you'll hear more through their home-based program through our drop-in center. So that's open 24/7 and is connected to our shelter as well.
Next slide, Sarah. You were right on the next one. Yep,
Oh,
and then there we are. So just a little bit about Wisconsin and our RHY providers. You see a really long list there. Wisconsin has a really unique organization called the Wisconsin Association of Homeless and Runaway Services that works to keep us all connected as providers, gives technical assistance, political policy advocacy, and we have a lot of connections and question and answers. And these are all of the programs that are part of that here in our state. So while we're going to focus more on how Home Base and House of Hope are connected, all of these organizations play a role into our model and how we function and how we achieve our outcomes. Next slide. So here's a little bit about what we're going to talk about today. We're going to get through our program and staff structure here at Home Base and how House of Hope fits into that. We have another organization that wasn't able to join us today that is also pretty significant in both of our functioning in and outside of the RHY world, and then a couple other more informal partnerships that Home Base has to run our runaway and homeless youth programs. And we'll talk a little bit about the Home Base service buckets, what they look like. I'll introduce you to just a little snapshot of our data, and then we'll have an opportunity to ask some questions at the end. Next slide. So here's our home-based team structure. We're an exceptionally small team covering 4 counties in northeastern Wisconsin. While there are only a few bullet points in those boxes, I promise you we all do a heck of a lot more than what's showing up in those boxes. But the short version is that I'm the director here. I oversee the leadership of the program, the hiring, the training, our policy and procedure, managing our referrals and our grants, and then building our community partnerships. I have an assistant director to kind of help take those things that are falling off of my plate. So he does a little bit of that admin space and relationship building, as well as the service delivery, and helps oversee the programmatic functions with our AmeriCorps members and our interns. And then we have our 3 case managers who are providing services in all of our service buckets. Next slide. So this is where House of Hope fits. House of Hope and the Boys and Girls Clubs of the Fox Valley are both part of our federal Runaway and Homeless Youth Basic Center Program grant. We work our services together. House of Hope is a support through their shelter opportunities and through their drop-in center. And that's how they fit into our model. We'll talk a little bit more on the next slide, I believe, about some other shelter options that we have within our Basic Center program. But House of Hope, Shannon, do you want to take over and talk a little bit about how you fit into our runaway world here?
Sure. Yeah. We were definitely appreciate the partnership that we have with Home Base and their team. And it, as you already know, it takes a village. So they do a lot of outreach services and will bring youth to us if they are in the Green Bay area and need to use the drop-in center, or if they are in need of shelter, since we're licensed as a shelter care facility to serve 0 to 17-year-olds. And then as part of Wisconsin Act 22 from 2019, we also do take 17-year-olds into our shelter, into regular shelter, not just the licensed shelter care. So anytime that there is a situation involving youth homelessness in our area, we like to try to make sure that we can help support whatever case manager they're working with to help meet their needs. And we do have some funding available to help youth, like I don't, you might have heard of the YHDP grant, the Youth Homeless Demonstration Program funding. And we have some rapid rehousing assistance as well. But some of those youth grants that we get just help us with removing barriers. We might be able to help someone that is a trusted, safe family member. We might be able to help pay a little bit of rent for them if they could then support having the youth there, or we could get a phone for a youth, different things that might be necessary or critical for someone to move out of a homeless situation.
Yeah, so it's a really unique partnership in that while the Boys and Girls Clubs holds our Basic Center grant, we don't provide the direct shelter services under our service umbrella. And that's where House of Hope comes in. And additionally, like Shannon talked about, they have an expansion of services and funding to help create some more wraparound supports and different tiered supports for our youth that are experiencing homelessness and might be in need of continued services. And like Shannon said, it takes a village, and one program can't possibly meet all of the needs. It's just not the way that we can really get everything that our young people need. And so having that unique cooperation and partnership with an entirely additional organization to be able to serve that population in different ways is really beneficial to how we're able to serve runaway and homeless youth in our area. Next slide, please. So the other very unique partnership in the foundation of our model is Foundations Health and Wholeness. Foundations Health and Wholeness is an organization that actually has several different service arrays across the state, but where they fit in with us is in their foster care program. They have an office in our region that licenses treatment foster homes, and we have a formal partnership with them to access those licensed foster homes as host homes. So it gives us a couple different options when House of Hope isn't a good fit, when House of Hope doesn't have openings, when our youth would like to stay, maybe more south rather than go north. And then it gives us that option to bring them into more of a family setting instead of a shelter setting. So we have both options for shelter needs. What we do is we reach out to foundations when we have a young person who's looking specifically for a host home scenario, and they connect with their foster homes who have agreed to also be host homes. We can serve youth that are ages 12 to 17 unaccompanied. Part of the limitation of a host home, which you saw with House of Hope, is that they're able to serve youth and youth that are parenting, which it helps us grab that extra bit of that population within the RHY world, whereas host homes are not equipped to take in teen parents. So we have both opportunities through this unique partnership in our model of how we can provide shelter to young people that might be eligible in that way. Next slide, please. So some other partnerships within our BCP model, and then I'll turn it over to Shannon to talk about some more that they have in that area as well. The Appleton Area School District is one of the largest school districts within our service area outside of the Green Bay School District. We have a formal memorandum of understanding with the Appleton Area School District that allows us and them to share basic identifying information to connect youth quickly to services. And what I mean by basic, they can share the name, the age, the grade, the school they go to, and anything about their surrounding circumstances that fits them into that RHY eligibility for services and support. That MOU really mainstreams connection and speeds up the urgency and the response time with which we're able to provide services and supports to youth within that district. It is the only school district that we have that formal partnership in place. While we replicate that model and that referral process with other schools, what other schools have to do is make their referrals in more of an anonymous way where they're not able to share the identifying name of the student. What that requires is that when we're responding, we now must go back through that referral source to set up that meeting, to set up that connection with the young person, and we can't go right to that young person. So we're at the mercy of the referral source, their schedule, their opportunities to meet, how many schools are they between, how many students are they working with, and it really does slow down that response time. Um, Still, that MOU with Appleton does create the foundation for how we work with other school districts in similar ways. We also sit on it's literally called the City of Appleton Interagency Collaboration. It's very creative. But it's a multidisciplinary team that brings to the table local EMS, so PD, fire department, ambulance, as well as our other local homeless providers that may be working with youth and or adults or families. It brings our county crisis and mental health in and it brings in our city government to start to work collaboratively on addressing the challenges that our homeless population faces. We're able to create more wraparound services right there in the moment. We meet every month. We have a formal release of information that all of the member organizations utilize as part of our intake process, so that right away clients are signing that release of information, allowing us to immediately collaborate with these other member organizations to meet their needs. We're connected with some local area police departments. Some of that is formal through MOUs. Some of that is a formal process on their end, signing for parent permission so that they can share their runaway reports with us. The City of Appleton Police Department actually has it formally written into their cemented policy that their runaway reports will come to us weekly. So that is how we are connected with them. We have another local police department where we have an MOU in place where they send us their runaway reports as they come in. We have another police department that preferred to do things on their end, where when they respond to a runaway report, if a parent signs the permission, then they will send it to us. So different ways of connecting with the police departments based on what they feel fits into the statutes and policies within their own departments, but still allows that collaboration and connection on their runaways. Winnebago County Shelter Care is a local shelter care that brings us in twice a month to do wellness groups with their highest risk populations. We put on some independent living, some coping skills. It kind of depends what population they have at the time, but that's another thing that we do. And then our partial hospitalization program brings us in once a month to do some program sharing with the youth that they might have in place at that time so that we can meet another high risk population and hopefully do some prevention work in that space as well. Next slide. So here's those service buckets that I was talking about. We have our one-on-one individualized support where we provide that case management and resource navigation. This is often where they become connected with House of Hope as another service provider and support as part of their treatment team. We can do case management for youth from age 12 to 21, and that has to do with some of the other funding streams that we come in that sort of complement our federal funding stream. Prevention and awareness education is done within our schools, primarily with our high school population. We serve almost up to 3,000, 4,000 youth a year through presentations. Every academic year, each classroom that we're in is getting the same presentation with the same information. And then each summer it's updated with new statistics, trends, risks, and things that might be kind of affecting our population. Our crisis intervention looks like our hotline, immediate basic needs support, safety planning, connection to resources, some of that like in the moment, here is what we are dealing with. We need to resolve this issue before we can possibly begin to wrap around. And that's how our crisis intervention services are delivered. Our outreach, we found that while we go between a rural and a suburban type setting, we are not finding a lot of our youth right out there on the street looking for support in that moment. So we do a lot more outreach in community settings where there might be a lot of youth available at one time, trying to create some familiarity with the team and with the program, and just some recognition in the community of where we are and how to find us. These are just a couple examples of places that you might find us. And then our wellness support, like I had talked about earlier, which we can do one-on-one or in groups based on the need and the location. We do offer family mediation. The intention of family mediation is to resolve some of those dynamics that might be leading to young people running away or leaving. It can be a one-time intervention. It can be a longer-term series. Once we roll into that space of having resolved the initial crisis or the initial dynamics, then we will refer on to like a family therapist. And then connection to those safer places, which could be House of Hope, which could be foundations. We have a couple connections with some transitional living supports. Oftentimes we're strengthening natural supports. And then in the state of Wisconsin, we do have Wisconsin Act 22, which will allow us to connect our unaccompanied 17-year-olds to adult shelter options. So it does open up a couple more opportunities and things that typically wouldn't be open until they're 18. Next slide. Here's just some quick data on sort of how we track what we're doing. This is a dashboard that we utilize. It primarily highlights those very specific service buckets that I referred to earlier. Up there in the right-hand corner is where you're going to see some of our smaller breakdowns and things by time frames, and any other connections that you might that we might be working on. You see Souls for Souls. There's an older partnership where we received 250 pair of shoes to distribute among youth that we serve. We're still kind of getting to the bottom of that supply, so we're still tracking that, but you definitely see smaller numbers there because that partnership has formally ended. This data shows 2024, so this is the culmination of our data. You can also see 2023 data there, so you can see where we've improved, where we've changed. For the most part, we're seeing the same kind of trend in numbers and upward reach and how many people we're serving in different buckets. Next slide. So here's some of our 2025 data. So the same thing you were just looking at, just the next year. This is only up and through September. We did just pull October data, but I'd already put this together, so I'm sorry I don't have that. But again, you see 2025 over 2024, and you can see where we've had some changes, some peaks in services, some declines in services, and similar service bucket areas based on how we're tracking things. So next slide. This is just a unique bit of data that I thought I would pull. Every year we do a very intensive data review where we get our new initiatives and our program improvements. And one of the things that we did back in 2023 was we pulled some home-based demographic data to compare it to the National Runaway Safeline's regional data for our region. We wanted to see if we were on target with who we were serving, with how we were serving them, and where there might be differences. So as you can see in this data that we're really kind of on par. I think the biggest thing that sticks out here is that we had a huge influx of 17-year-olds, and the National Runaway Safeline wasn't seeing that regionally. But as a whole, we're really sort of aligned with what the National Runaway Safeline was seeing for our region. Next slide. So I realized that I accidentally skipped over Shannon talking about some of her unique partnerships, so I apologize for that. I'm just going to turn it back over to Shannon quickly to talk about some other unique partnerships that they have connections with through House of Hope, where we might be able to continue youth along that continuum of care.
That's okay. You were doing a great job.
Thanks.
Yeah, so I guess, the things that we do that might be a little bit different in addition would be that we have some work that we do with the Wisconsin Balance of States COC and WARS, Wisconsin Association for Homeless and Runaway Youth Services, where we have a coordinated entry system navigator that is specifically for youth. So we're out there in the community at the library or at the school, helping to make sure that youth are connected to the housing programs that we have in our communities. And then we have a youth specific rapid housing program. So that provides rental assistance and support. In some cases, we might be doing mediation or AOGA counseling with youth and then helping their entire family once we figure out like what the whole situation is. We might be helping to house their whole family then at that point if they're all in their car or in a place not meant for human habitation. We do partner with law enforcement and child protective services, and recently decided that we were going to start meeting quarterly with them because we have a few cases that we feel like we could partner more on together to serve the highest barrier community members that we have and youth that we see cycling through systems that we want to end that cycle for them. We also work with our local housing coalition, the Groll County Homeless and Housing Coalition. And every year we do a point in time count where we count people sleeping on the street, and our youth have been helping with that. We have a youth action board that meets here at House of Hope. We have a couple of youth on our board as voting members, and they attend the youth action boards. They also have lived experience with homelessness, and then they meet to tell us like what we need to do in the shelter that we're not doing so great yet. They've designed the drop-in center. They make decisions on what goes in the bedrooms, and they pick out things like beanbag chairs and things to plug all their devices in that they need, along with giving us advice on what services they need and what kind of staff they want us to hire. And then along with that, we have the Youth Action Board advise other community members. So, service providers can come and ask them questions, and they're connected with the Balance of State Continuum of Care staff members. So they can give feedback on things like the coordinated community plan to end youth homelessness in our area. So those are some of the other things that we do outside of, just shelter and other services. Yeah.
Yeah, I think one of the things we really wanted to make sure that we highlighted today and give opportunity for all of you to ask questions about is the unique way that we've built our collaborations and our service spectrum, in that shelter is often a high focus in our RHY world, as it should be. And we know there's always an and of what else our young people need. And it's important that we as providers kind of look at our communities and how they're structured and what works and what doesn't. And what other organizations and programs can we use to fill some of those gaps so that we're not trying to do everything. It's very important that when you think about building your model, that you really are the expert within your lane and you don't become a jack of all trades and an expert of none, because then we're not doing what we're trying to do with our young people. And so when we talk about what's working in our area and what's not, it's really from that bit of experience of trying to meet the youth and meeting all of those unique needs and what are we seeing. Like I mentioned before, we don't see our young people out there in the street. They're very, very invisible here. And we have to put a lot of effort into how we partner and access and identify the young people that need our services. And creating those partnerships with the experts out in the community so that we can create that village around the young people in various ways. And it's okay as you build that model to kind of give something a try and be like, all right, this didn't yield what we were looking for. You give it another try and then you walk it back. And I think an example of that, like Shannon had mentioned, they are part of the coordinated entry system. Homebase is not. We have been historically. We had a position that was specifically allocated to being the youth point of coordinated entry. And it didn't prove to be conducive to what our program and our community needed. We played it out. We revisited that collaboration that created that position, and there was just that all-around mutual agreement that this wasn't what our community needed. So it's equally as important that you try some of those innovative things, even if they don't yield the result you were hoping for. You still learn something from that. You still move forward in some of those more unique spaces in that way.
Yeah, I think that goes with all of your community partners too. So we will bring in people to work with youth. We have a anti-trafficking program where we're bringing in Her Alliance from our community that works with people specifically. They specialize in anti-trafficking, helping survivors to heal and reconnect and gain stability. So they'll come in and work with people, and they're trained to do that. That's their specialty. We'll do that in a lot of different situations, making sure that we have the experts in the room and connecting youth with other community members that are safe people and safe supports is really important because maybe they are staying at House of Hope's shelter and they just don't click well with a House of Hope staff member and they'd rather work with one of Katie's team members at home base. And they can do that then because then they know the home base team or they know the Raise team from Foundations. And the more safe, supportive community members and agencies we can connect youth with, the better they are after they leave our services or if they decide that they want to make a change for themselves. So giving them options and choices of safe people to go to is really helpful.
So I want to give an opportunity for any questions or any ideas you guys may have floating around there that you want to explore and maybe asking how to get started with some of those things. Any unique partnership or collaboration that specifically stuck out to you?
There is a couple questions in the question and answer portion. For those of you who may not know how to use that, at the bottom of your Zoom link, you will see a Q&A box. You can feel free to put your questions in there. And we have a question asking, what success have you seen through your high school outreach? And an example is just awareness or more direct referrals, etc.
Yeah, short answer is both. I didn't pull that data for you, but one of the things that we do look at year over year is our referral sources. And then what we continue to see is that an overwhelming majority, meaning well over 50% of our referrals are coming from schools, school personnel, school staff. And teachers and things in that. And then we break it down even more by school so that we can determine which schools we need to build more relationships with. So yes, it is increasing referrals, it is increasing connection, and it's also increasing awareness among the youth within those schools. So then when we come back, or when we pop back in for the prevention work, they're like, hey, I remember you. You were at my lunch hour. You had that table. So it does yield results with awareness and comfort and referrals. It's been a very successful strategy for us.
It's also really good to make sure that you know who your McKinney-Vento workers are. In some schools, especially the smaller schools, they might not know who that person is, or that person might not know what they can do to help you. So it's important to learn about that before you call. But connect with your McKinney-Vento workers and see how you can partner together. We get a lot of referrals directly from just that person in our school district. And then we also see a great amount of success with teachers coming into the building. So they'll come into the building and, maybe provide support for connecting youth back to school or dropping things off. They get really involved that way. And then that's also your opportunity to talk to teachers in schools about the challenges that youth have, because when we see youth that have been transient and go from town to town, their chances of graduating greatly decreases, as you probably all know. And it's because not all of their credits transfer since, it depends on the state you're in and what your rules are in your education system, but it's governed by each state. And so schools don't necessarily all have to allow credits to transfer from one high school class to the next.
The other two questions are similar of, will this PowerPoint or an email be shared out? I know that this lunch and learn will be posted on social media. And Neff, I would probably have to refer to you on that if we would be sending out of the PowerPoint. Not sure if he can come off mute or not.
Yeah, we
Oh, go ahead.
can, I I know we put the video live last time and we could add the PowerPoint deck to our toolkit where the video will go. It'll be on our
Okay.
YouTube. We'll send a link that just saying, hey, it's live on social media. But we can also drop a link to and kind of get those decks and put them up there as
Okay, great.
PDFs to get.
All right, great. We've had a couple more questions pop up. What tool do you use for data collection, and is it a specific database or just data pulled from an Excel sheet?
Yeah, so great question. We're in the midst of a transition with our data. Initially, our data within Homebase and the channel, and I'll let you talk about how House of Hope does it. But we did initially use spreadsheets. It was pulled. We have a lovely position here at the club that is dedicated to continuous improvement. And so Excel spreadsheets are not my language. I created them to gather what I wanted, and then she taught me how to get them to tell me what I was looking for. So we do primarily right now pull our data. That dashboard you saw is pulled from our spreadsheets. We are in the process of rolling into a database, an internal database created with internally to meet our specific needs. Some of our service buckets are into that database now and some are not. It is a rollout program process that we're following. And that sort of goes with talking about the unique collaboration, right? Because what we learned as we continue to build our collaborations, to build our services, to build our supports, to build our youth served, is that we outgrew how we were gathering our data and we needed something better. So we're in between that Excel spreadsheet and an internally created database for our specific need.
At House of Hope, we use the Homeless Management Information System, or HMIS, which is Clarity for us. And that doesn't tell us all that we need to know because it doesn't really track shelter capacity and some of the other outcomes that are really important that HUD doesn't mandate in that system. So we also use Excel outside of that system.
Let's see, there's another question. In terms of outreach, how do you balance organizational outreach, such as tabling, building relationships with community partners, etc., and direct outreach, such as finding youth in safe locations in the community?
Yeah, so great question. We sort of, I would say it's primarily tabling. And the reason is that through many years of trial and error, that is what we have found to be the most successful. Where we do some of that, just connecting with young people is more going to be in the drop-in centers. And like that partial hospitalization program, but even that is planned, it's scheduled. So we haven't found a lot of success in our area with the just popping into where young people might be. And some of that is just the locations that they are finding safe, we're already involved in with other youth organizations, with their schools, here within our clubs. And so the tabling has become our most successful in that we're going to youth wellness fairs, we're going to community events. A really neat thing that one of the high schools around here does every October is what they call a trick or treat wellness fair. And they set up almost like a haunted trail around their high school track and bring in youth wellness organizations. And in order for the kids to get a piece of candy, they got to stop and talk to you. So that's another unique collaboration is we take advantage of that for the awareness of our program and none of the work falls on us for the creation of it. So we find those unique opportunities and they're the most successful for our program.
I'd say House of Hope does have a lot of youth just drop into our drop-in center since it's open all the time. It never closes. It's open 24/7 every day, even holidays, even Saturdays, all the days. And so that helps because then police, school workers, adults, safe adults in the community may bring someone to us. And then the other thing that we do that we find effective is that we reach out very intentionally to a list of contacts, and we literally just have an Excel file of contacts that we organize by like any youth service organizations, schools, social service delivery organizations, like alcohol and drug abuse awareness programs, other shelters, even daycares, YMCA, any kind of like all the schools, boys and girls clubs. Brown County like has a lot of programs like Friends of Pals, they call it. It's just like they like help with when there are like visited, supervised visitations. They may help get those families diapers or whatever. But then as a result, they may also see families that have teenagers or young people that need help from us. The Croc Center, anything like that. We'll reach out to the people who are working there and develop a personal relationship with them, and then make sure that they know how they could refer youth to us and what our services are in case they see somebody in a situation that is more of a crisis situation. And then because you do have to build in capacity for this, we have an actual person that is the youth system navigator for the whole county, and they'll meet with all the service providers, and they'll go, talk to the McKinney-Vento workers. They'll do the point in time count. They go to all the youth action board meetings. And then we serve youth in our shelter. So our shelter is really focused on 24 and under, and then, the 17 and under. So they are working directly with people that we're serving and then developing relationships with them. And then sometimes it's word of mouth, like, oh, I also know my friend is having this situation, and they may refer in that way too.
How much of your outreach is to youth below the age of 17 versus 17 to 24? And do you feel as though one is more effective?
I would say the bulk of our outreach, probably about 80% is 17 and under. And that is just the opportunities that we latch onto that become successful referrals are more geared towards that age. We are sort of in a location where we're surrounded by various secondary educational settings. And on occasion, we're able to target more the 18 to 24s. Most of our outreach for that age is really going to providers that are gonna connect those young people to us, because it's very difficult to find them gathered in one space at that age group.
Yeah, and I'd say for us, I think because we're shelter focused, we have a number of each population, but we also have a separate person who does adult outreach. So, even though they're providing outreach to 18 to 24-year-olds too, we have another person who works with adults and families with children. So we have separate staff members that focus just on youth 17 and under and on young adults 18 to 24 years old. So we see different numbers. We definitely serve more of the older population because they're legally able to consent to services.
Mm-hmm.
So.
Yeah, whereas we probably see a pretty good spread between under 18 and over because of when we're providing services that are not shelter. One of the things to remember when you're considering your outreach strategies is that outreach is really a more inclusive label, and it can include some of that, like Shannon had talked about, outreach to specific organizations. So that interagency collaboration that is put on by the city here that Home Base is a part of, that is where we get a lot of our 18 to 24 collaboration, because most of those organizations around the table do not serve minors. And so when they're coming to the table to problem solve solutions for those experiencing homelessness, they're more in tune to the 18 and overs. So while it may be more difficult for us to find them in the community in larger groups where they're gathering in those sort of settings, then we sort of shifted our strategy to what collaborations can we form that gives us access to them, so they become that intermediary between us and our 18 and overs.
How do organizations become community partners, and what is the responsibility of partners?
Yeah, I think it depends on the partnership, right? Obviously, our biggest, most formal partnership is with House of Hope. We are both responsible to that grant, to those outcomes, to the administration of that grant, and how we provide services in that way. So that is a very formal partnership. We meet regularly. It's on paper, it's signed, all of the big things. But it does trickle down all the way to some of those smaller, more informal ones. Um, and it comes from connections and relationships. Um, Everybody who is providing a service wants to provide the best service, full of integrity, making sure that they're connecting their clients to something that will meet their needs and that is trustworthy. And so, how you vet those is going to be important, and it's going to be specific to your organization. But it starts with building that connection and relationship with that other organization, starting to talk about the common missions, starting to talk about expertise, service gaps, how you fit together. I know the puzzle piece is a really like cliche um, way to create that image, but that's the truth. That's what we need, is we need all of these things to fit so that there's that continuity for the people that we're serving. And so as you have those initial conversations, you talk about the big ideas. Like for example, we had, like I had said, that relationship with the Appleton Area Police Department that has predated my birth. That's how long we have been written into the Appleton Police Department's policy and procedure for how they make runaway referrals. But what I did when I came into this space is I took that as an example and started meeting with other police departments. And then I would let them tell me what they wanted on their end. So I have a police department to the south and a police department to the north, where we have the same sort of arrangement, but the structure around it is different. The one to the south wanted an MOU in place. They felt more secure and more safe and protected in that MOU. The one to the north, they wanted to leave that option and permission to the person calling in a runaway. So they created almost like a release of information. And then they felt comfortable making a service connection. So it starts with the relationships. That's how it starts. The relationships and then the conversations about what can we do for each other to better serve our communities.
I think that Kate did a good job answering that one. I could add that we do um, some work with like advocating too. So like Katie's group and our House of Hope team really encourage youth to do that. So partnership might also be like your legislative partners and your elected officials. And, you know, if you're meeting with your youth and they're saying, we need this and we don't have that, or we don't have these rights, or this is what's in our way, or this is a barrier, then we try really hard to make sure that we listen and then show them that we're listening, because we really want to close the feedback loop so that they keep giving us feedback and keep feeling supported and appreciated. So if they tell us, here's this law that we want to change, or if they say like, we need, you know, the ability to get healthcare or mental health care or whatever it may be, we're connecting, we're advocating with all those bigger groups that we are part of. And then they're taking that to the Capitol and, you know, as a bill. And then we're taking youth to the Capitol and having them testify for that bill, or even just sit and see what the process looks like to show them that they can make a difference. We don't mandate participation in our programs for them to stay here or to be part of our efforts, or to come hang out at our drop-in center. They can just be who they are. You know, we're focused on giving them a normal teen experience. So even if we have a partnership with somebody, we're not making them go to that program or that activity. We do make sure that we have formal memorandums of understanding with all of our partners. They are signing confidentiality statements that they're not going to, you know, go and tell everybody who's here. In situations where they're working closely with youth, we'll do background checks. We'll do caregiver background checks on people. We don't allow for them to just be alone with youth in a situation that could feel bad to youth, or whatever it might be. We just have cameras in our rooms, that we have, you know, clear windows in our meeting rooms. There's never like a closed door, closed wall situation with youth. We just make sure that everybody can see what's going on, and that youth feel supported and seen. And then some of those partners that we have MOUs with, they might do like counseling services. So that's a service that could be provided, or maybe they'll provide group classes. We had somebody come in and teach youth how to spin records and make their own digital like music album. They thought that was pretty cool. So it just depends on the partner, like Katie said.
Do you have any recommendations to help organizations or agencies build relationships with their local law enforcement?
Yeah. You got to find the right person in the police department. So first and foremost, I think our unit, I will speak in I statements because this is my experience. My experience across the board with the multiple police departments that we have come in contact with is that their response time is significantly different than that of service providers. So be patient because you do need to poke them a couple of times. You do need to keep coming back to them. Forming the new relationships and the new services and things. It's not urgent to them like it is to us. And I don't mean that in a bad way. It's just a difference in our vocations. It's a difference in how we function. Something that we've found successful is our primary contact in our larger police departments has been whoever the officer is that oversees the school resource officers. That's just been where we've had the most success in our larger districts. And then in our smaller districts, we just go right to the captain. And they're more often than not in the smaller ones, the captains are willing to meet and to talk and to see what we can work out. One of the things that I suggest when you're building those relationships is having an idea of go in with compliments of what their district does well, how they support the community, what you're looking for, and what your organization is going to do in return. And I don't mean like a, you do this for me, we'll do this for you, but more of a, we see youth in our need, in our community in need, and we know that you are dealing with a lot. We want to be a connection point. We want to be a support for the things that you're doing, and here's what that can look like. So how is what you have to offer young people going to support the work they're already doing? It's a really important piece when you're talking with the law enforcement.
You can also offer to provide training to officers, your virtual training or in person. Like sometimes those school liaison officers really like to have extra training on like how to identify a trafficking situation or what are the signs of that they can look out for. You can teach them about your state statutes because they change so much and there's so many different rules and laws to remember that officers need help from us too to make sure that they understand the youth rights that of the youth that you're dealing with in your area. And often as a youth serving agency that provides overnight services, we're having to teach officers about that frequently. So sometimes they may say things like, well, if you don't want to give us information about what youth is there, then that is not cooperating with the law enforcement and that is not legal. But in our state, there are some protections for that. And we can then have that ready, train our staff to be like, hey, give that officer the benefit of the doubt that they just don't know what that rule is and give them that rule so that they can act accordingly. And then we also need to teach our team members that there are different private and public spaces. You don't need to let, depending on the rules that you need to follow in your area, you don't need to let an officer take a child out of your care if they're staying in your shelter overnight. If they are runaway youth and there are protections in place. And so like for us, we have to make sure that our staff members know and understand that. And that the youth have some protections in that situation so they don't just get put back into an abusive situation and the officer's not realizing it because sometimes the guardian can be telling them a totally different story and the officer's, just trying to do their job and return the youth to the family without realizing there's more going on that you know about.
And then this is probably the last question we have time for, and it is, what does your aftercare look like?
So I'm going to let Shannon answer that one. And the reason is that because we most often don't handle sheltering within home base, aftercare for us looks significantly different with our one-on-one young people. Um, Anyone who we've had in a host home, part of the requirement of their access to a host home is that they're engaged with their case manager. So aftercare can look like meeting one-on-one with their case manager, even post host home stay, and continuing to work on goals for safety and stability, a minimum of once a month. But Shannon, I'll let you talk a little bit more about like shelter aftercare.
Yeah. And we do some similar stuff to that. So our case managers will follow up every so often, for sure, 30, 60, 90 days. And then the youth that we see often do come back and visit us. They'll hang out in the drop-in center. They might miss the staff member that they connected with, or just want to come in. Maybe they have a baby and they need diapers or whatever it might be. We provide health and hygiene items for as long as they need. And or a place to do their homework or get help with things. We have snacks in our drop-in center, and the youth decide what snacks those are. So, we'll go grocery shopping, and I mean, they're actually like full meals in there that they can make. They can do laundry at our building and take showers. So sometimes they just come and do that. Sometimes we see youth that are just afraid to be in their own home at first, and so they might just come back and see if they can watch a movie with our team members or hang out a little bit in the kitchen. And so we kind of just leave the door open. They can come back for case management services, counseling services, any kind of mediation that they need. And sometimes they may transition into a different program. So they may move into a regular shelter, or they may move into one of our housing programs, and then we're with them more long term. We let them decide how they want us to engage with them. We're all about youth choice. But if you're going to do that, you have to then follow through and actually do it.
Yep.
Well, on behalf of NRS and FISB, I hope this has been helpful for everybody who attended. Thank you so much, Katie and Shannon, our presenters. It's been really informational. And we encourage everyone to go to 1-800-runaway.org for additional information and resources. Also, don't forget to follow 1-800-RUNAWAY on social media for all the latest Youth Hope Month activities. Thank you guys so much for joining, and we hope everyone has a great rest of your day.
Thank you, Sarah. We appreciate what you do.
Thank you.
Thanks, Sarah.
Thank you.